Arterial pressure indicates the force that blood exerts against the walls of the arteries, following the contractions of the heart muscle, engine of the cardiovascular system and of our life. During the cardiac cycle, the four heart chambers go through a period of contraction called systole and a period of relaxation called diastole. The continuous alternation of these two periods causes continuous pressure variations, indicated respectively with minimum or diastolic pressure and maximum or systolic pressure, both indicated with the unit of millimeter of mercury. According to the guidelines of the Ministry of Health, a diastolic blood pressure lower than 80 millimeters of mercury and a systolic blood pressure lower than 120 millimeters of mercury are considered optimal. However, when the minimum pressure values exceed 90 millimeters of mercury and those of the maximum pressure exceed 140 millimeters of mercury, we speak of arterial hypertension. It is a pathological condition characterized by the constant presence of high blood pressure in the arteries. However, it is not a disease, but a risk factor capable of increasing the probability of being affected by a stroke, myocardial infarction, renal failure, and other cardiovascular diseases. In Italy, arterial hypertension affects an average of 33% of men and 31% of women, and half of these are unaware of it, since in most cases it does not give symptoms. But how do you lower blood pressure naturally? Let's go and see the indications dictated by the Italian National Institute of Health. The first thing to do is to modify and improve one's lifestyle, in particular by eliminating those harmful habits that worsen arterial hypertension. Reducing excess body weight. The ideal body weight varies from person to person and is established on the basis of certain parameters, such as gender, age, and height. Some epidemiological studies have well documented the association between body weight and hypertension. In overweight and obese people, excess adipose tissue increases vascular resistance and therefore the work that the heart has to do to pump blood around the body. This will lead to an increase in blood pressure and the risk of developing cardiovascular complications. Reducing body weight can normalize both systolic and diastolic blood pressure levels, thereby reducing the effort of the heart. Even a modest weight loss can make a difference. Just think that for every kilogram of weight less, blood pressure is reduced by 1 millimeter of mercury. Reducing blood pressure by just 5 millimeters of mercury reduces the risk of stroke by 34% and heart attack by 21%, as well as the risk of developing vascular dementia, heart failure, atrial fibrillation, and death from cardiovascular causes. Reduce your sodium intake. Sodium is one of the most abundant minerals in our body and plays an important role in maintaining the hydrosalt balance in the transmission of nerve impulses and in muscle contraction. In an adult, there are about 92 grams of sodium, of which 40% is found in the blood, especially in the extracellular fluids, while the remainder is distributed in the bone, connective, and cartilaginous tissues. Among the other functions of sodium, we find that of regulating blood pressure. It has been demonstrated by several studies that a high intake of sodium in the diet favors the onset of hypertension, as well as water retention, and causes inflammation of the internal surface of blood vessels, favoring the stiffening of the arteries. Some studies have found that a modest reduction in salt intake for 4 or more weeks causes a significant drop in blood pressure, both in hypertensive and normal weight subjects, regardless of body weight and ethnicity. The World Health Organization recommends consuming less than 5 grams of salt a day between what is already present in foods and what is added, which is equivalent to about a teaspoon. Fruits, vegetables, and dairy products. To lower blood pressure, the Ministry of Health reminds to consume a sufficient amount of fruit and vegetables and low-fat dairy products, such as yogurt and skimmed or semi-skimmed milk. They contain what are called bioactive peptides, that is, small fragments of protein obtained from the digestion of whey, which promote less rigidity of blood vessels and therefore a reduction in blood pressure. However, the case of salty cheeses rich in saturated fats, cream and butter is different, which given their high amount of fat, any benefits on blood pressure risk being less than the damage produced on cholesterol and triglycerides. Increased dietary intake of potassium. Potassium, like sodium, is also one of the minerals most present in the body, and in the body of a healthy adult there are about 180 grams. 98% of sodium is found in intracellular fluids, where it performs the same functions that sodium performs outside cells, such as regulating the balance of cellular fluids and muscle contraction, including that of the heart muscle, as well as controlling blood pressure. However, when low levels of potassium are present in the blood, this is called hypokalemia and can increase blood pressure values. In fact, the Ministry of Health recommends increasing the dietary intake of potassium to treat hypertension. This is because, according to some studies, potassium could counteract the effects of sodium and act as an antidiuretic agent, thus reducing the volume of extracellular fluid, which in turn could cause a decrease in blood pressure. Among the foods rich in potassium, we find beans, dried peas, asparagus and cabbage, potatoes, bananas, and apricots, but also in dried fruit. Physical activity. Sport is the best medicine to prevent various health problems, including hypertension. However, having high blood pressure does not preclude the possibility of doing physical activity. Just have some precautions regarding the choice of the type of physical exercise and how to do it correctly. Among the most suitable physical activities in case of hypertension, we find walking, whether on the treadmill or outdoors, cycling, and free swimming. Aerobic exercises in general reduce blood pressure and heart rate. This is because when you train, the body's demand for oxygen increases, and consequently the heart and lungs are forced to work harder, improving their functionality over time. The heart muscle will thus be able to pump a greater quantity of blood more easily and with less energy expenditure. Regular physical activity also improves the elasticity of the blood vessels and the blood flow to the various tissues of the body, reduces vascular resistance, and enhances the coronary microcirculation. Moving more and sitting less is a rule that must apply to everyone. We start by changing some simple habits, such as taking the stairs instead of the lift, or walking and not using the car, obviously if the destination is not too far away. Experts remember that in the case of hypertension, attention must be paid to moderate intensity activities, such as weightlifting, as it causes rapid increases in pressure, which, although temporary, can overload the heart. In case you suffer from hypertension, before starting any sport, talk to your doctor, who will evaluate the most suitable physical activity for your medical condition. Quit smoking. A single cigarette, as well as containing 4,000 chemical substances, of which 400 are toxic and 40 carcinogenic, is capable of increasing the blood pressure of those who smoke it for at least a quarter of an hour. Now think of a person who smokes a pack of cigarettes a day and the continuous pressure variations to which his heart is subjected. Although the link between hypertension and smoking is not yet fully understood, quitting smoking can help return blood pressure to normal, as well as reduce the risk of developing various types of cancer and cardiovascular disease. Moderation in alcohol consumption. Alcohol is a toxic, potentially carcinogenic and addictive substance. It is not a nutrient, and its consumption is not useful for the body or its functions. Contrary to what many think, there is no consumption of alcoholic beverages, even minimal, without health risks. Excessive alcohol consumption increases blood pressure, so long-term abuse of alcohol can lead to the onset of hypertension. The mechanism is not yet fully understood, but hypotheses include an imbalance of the central nervous system, an increase in sympathetic activity or cortisol levels, a stimulation of the endothelium to release vasoconstrictors, or a stimulation of the renin-angiotensin system, an important hormonal axis that regulates blood pressure and circulating plasma volume. According to the results of some studies, reducing alcohol intake is effective in lowering blood pressure in both hypertensive and normotensive subjects and can help prevent the development of hypertension. According to a systematic review published in the well-known English scientific journal The Lancet, the positive effects on the reduction of systolic and diastolic blood pressure are more evident in heavy drinkers than in those who consume moderately. In contrast, people who drank 2 drinks or less a day did not have a significant reduction in blood pressure when they reduced their consumption. In conclusion, a reduction in alcohol intake reduces blood pressure in a dose-dependent manner, with a possible threshold effect of 2 drinks per day. The Italian National Institute of Health remember that all of these lifestyle changes we have discussed can only reduce blood pressure values if they are maintained and followed regularly for at least 6 months. However, they are not always sufficient to lower blood pressure, so it is necessary to combine drug therapy, which involves taking specific drugs for hypertension and must always be prescribed by a specialist.